everyone. I want to talk to you about body temperature measurement. Body temperature measurement. Get the correct temperature. Why? If wrongly diagnosed as being sick, or if you are cleared of any sickness based on the value of the temperature, unnecessary interventions will be embarked upon or necessary ones will not be commenced. Let me put it right again. If your temperature is taken when actions are expected to follow, if someone reports a lower temperature or within the normal range and actions are not taken, that is detrimental. And it is also good to say that if your temperature is not high, but the report gives a very high temperature, unnecessary interventions will follow, and you'll be dealing with side effects or complications of such interventions. So that is why it is extremely important to make sure that the temperature is rightly taken so that appropriate interventions could follow. In elderly, the value of temperature is not the determinant of health status. Let me repeat. In elderly people, my grandfather, my grandmother, the value of the temperature in them is not the determinant of health status. For example, if you listen to my presentation on pneumonia, and I'll make other ones on urinary tract infection and the rest later on. I specifically mentioned that in elderly, you might not have classical symptoms of pneumonia like cough or high temperature and so on and so forth, because you can't use the thermometer to determine whether my grandfather or my grandmother is truly sick. In elderly, let's be careful. The value of your thermometer is not the determinant of the health status of my grandfather or grandmother. Temperature is a part of vital signs. The value dictates the measure to take during one, an ongoing infection. Because if somebody is having an infection and you want to determine whether you are winning or not, one of the parameters is the value of the temperature. And like if it is a viral infection, you expect low-grade temperature. If it is bacteria, you might expect a higher temperature. But if it's not taken correctly, you need your laboratory diagnosis to back it up at that point. Infection and you are already on treatment and you want to know if you are winning or not, particularly in children, you need the value of the temperature. If your patient or yourself, your brother, your uncle is on certain medications like antipsychotics, they cause what we call neurologic malignant syndrome. In that case, there will be high temperature, rigidity, and all the sorts. You need the value of temperature to guide you along that. And even some of these antipsychotics have temperature dysregulation effect. You need to judge that correctly. Starting anesthetic agent like succinylcholine in malignant hyperthermia will warrant temperature monitoring. And you need to get it right so that appropriate interventions could be embarked upon on timely basis. Summertime, heat wave. Why not getting it right? Get the correct temperature and embark on correct intervention on time. If not, the individual could die from heat stroke, heat exhaustion. Some concerns like lymphoma and leukemia on medication or not, and you want to know the progress of events, correct one. Okay, winter time, cold weather. Yes, in fact, the government is doing it right. So many TV channels telling us what the temperature is, so many apps on so many devices telling us what the temperature is. Why? So that we don't get frostbite. We can die from severe hypothermia. Frostbite can lead to physical deformity by the time your hands, your legs are amputated. You know what I'm talking about. I pray we won't get there. And of course, it's a routine system in the hospitals. The first thing at the nursing station, take vital signs, and temperature is key. As you take the blood pressure, take respiratory rate, heart rate, the 90's temperature. Now pain is added. So we can't overemphasize the significance of correct temperature measurement. Who measures temperature? The answer is everyone. Why? Nurses, doctors, paramedics, parents at home. Now, I know the parents that are listening right now would have maybe once upon a time measured the temperature of their kids. Grown-up kids do it by themselves. All adults, well, don't let me say all, most adults would do. Which instrument are you going to use? Yes, thermometers worldwide. Now, some smartphones have apps with sensors to measure temperature. I'll talk about that in a bit. How is it reported? Yeah, two ways. Degrees Celsius to those who are using SI units, and that is very common around the globe. And of course, degree Fahrenheit to those who are still using the old metric system, those who are still using the old system of measurement. Now, I'll pause and I want you to see how you can convert from Fahrenheit to Celsius. So you get a Fahrenheit, take 32 from that, multiply your result by 5/9, and you have your value. Again, I'm going to pause a bit. If you have degrees Celsius and you want to know what the value is in Fahrenheit, you have your degrees Celsius, multiply that by 9/5 and add 32. And that will give you your Fahrenheit value. How can we measure the temperature? How? Richter, the best method used in infants and children. However, it is contraindicated if there is neutropenia or thrombocytopenia in anyone. And it is likely the individual may sustain trauma and bacteremia with or without bleeding. The oral thermometer is used in older children. It is 0.5 degrees Celsius less than the value of Richter thermometer. The food in the mouth, drink, or breathing can alter the values. For example, you just grab someone who has just finished taking ice cream and you put the thermometer there. The temperature would not be the true or the core temperature of that person. Or the person has just zipped coffee, very hot one, and you insert your oral thermometer. you know what the outcome will likely be. Auxiliary. It is lower than rectal temperature, but can be used where rectal temperature measurement is contraindicated, like neutropenia or thrombocytopenia. That is the advantage of auxiliary when you compare it to rectal. But the value will be lower than that of the rectal. Tympanic membrane. You just bring it close to the ear, and it is going to be close to the core temperature, but it's not reliable in determining clinical facts. In other words, you want to use the value of the thermometer to make judgment on what to do. Tympanic membrane might not be the best. Non-contact forehead thermometers using temporal arteries. It may be greater or lower than rectal temperature. Smartphones apps. Well, I'm just presenting this for your information. It is not recommended. Some smartphones now have the apps for measuring temperature with sensors, but I won't use that. I'm not recommending that. Follow your sender's protocol as per temperature measurement, because it is extremely difficult to limit anyone to one particular method. In hypothermia, use low reading thermometer, but not many thermometers can read anything below 34 degrees Celsius. Esophageal temperature is the best when you want to determine the cardiac temperature through endotracheal tube. Bladder temperature is also good, but when you are rewarming and you want to know the exact core temperature, only esophageal temperature at the lower third will be the true reflection of the core temperature after or during rewarming with humidified oxygen or peritoneal lavage. Let me repeat. This is a hypothermic situation. We want to know what the true value of the temperature is, and we're already rewarming. Only esophageal temperature at the lower third will be the true value. Hypothermia is anything less than 35 degrees Celsius or anything less than 95 degrees Fahrenheit. 35 degrees Celsius to 32 degrees Celsius is regarded as mild hypothermia. If it is anything between 32 degrees to 28 degrees Celsius, that is moderate. But anything less than 28 degrees Celsius is severe hypothermia. And remember, when I started, getting the exact temperature would determine how you go about the appropriate intervention. In conclusion, it is a small thing and truly could be or could appear so, but the impact is remarkable. So, get it right. More videos will be out soon on some of these tiny stuff that we sometimes overlook, but some lives have been lost due to errors handling them. Thank you for listening to my presentation. Kindly subscribe so that you can be getting these as soon as they are published. Thank you.